for agreeing to do this interview. You've had a remarkable career over the past 35 years at the University of Edinburgh, pioneering teaching and research in health promotion and inspiring so many in the field in general and in tobacco control in particular. So let's start. Can you tell us what brought you to your first lectureship in health promotion in 1985?
Well, first of all, thanks, Sarah, for asking me to do this. It's fascinating to reflect on 35 years plus, and particularly with you, as we've been colleagues for 30 odd years. So we've shared many ups and downs, lots of very positive. I was originally a molecular geneticist, and that's what my PhD was in. And I came to Edinburgh to actually work at the MRC unit in cytogenetics. But I got increasingly disillusioned in that it wasn't for me, even though it was a very exciting field to be in. And I'd always been interested in women's issues and increasingly in women's health issues, and got involved in organising the first ever Scottish Women's Health Fair, and was very fortunate to be able to transition from genetics into public health by getting a fellowship from the then national agency, which was called the Scottish Health Education Group, to do what was then called the MSc in Community Medicine at the Usher, which was transformational. And then I went to work in London for a couple of years, setting up a health promotion department there. And then was really lucky that I got the 5-year lectureship in health promotion at Edinburgh. So came back, and it was a very exciting time because health education was becoming health promotion, which was a much more political, structural approach to health and health inequalities. But there was very little theory or research or practice to inform it. So it was great to be at the start of developing teaching and research in the field, and with lots of colleagues around the place to get involved. But reflecting on that, I was thinking the importance of the national agency at the time at both funding studentships to start to develop the academic basis of practice, but also the lectureships. There was one in Edinburgh, there was one in Glasgow, to develop the academic side and postgraduate courses. So the importance of having agencies that have strategic vision and are willing to invest in research and teaching in the field.
I think that really helps us understand what resources you need to shape a field and how you need that strategic investment. So I think that's very interesting and something for us all to think about as we develop the Usher Institute. I'm sure we could talk for quite a long time actually about genetics and health promotion, and some people may not know that we've worked together on looking at the social and ethical issues in genetics. So you never left your science background completely behind, and it must be really interesting to see that developing also through the genetic epidemiology and molecular epidemiology in the Usher. But let's talk a little bit more about teaching. You set up a very successful MSc in health promotion with innovative pedagogy, and created the very first health promotion course for our MBCHB students, the first course that was compulsory and examinable in Scotland, maybe beyond. So tell us something about that, and kind of also what we can learn from that today, I think, as we continue to really think about the very best way to teach, and particularly in the online environment that many of us are teaching in, not just because of the pandemic, but also because of the way in which we're developing our portfolios. Well,
because the field was emerging, it was very much a partnership approach, and that was fantastic. That I had fantastic support from the national agencies and colleagues there, but also from the local health promotion departments, Graham Robertson, Andrew Tannehill, who went on to head up Health Education Board for Scotland, and lots of colleagues who were really keen to get involved in teaching and also research, because I did my first research study in Edinburgh was with Lothian Health, looking at tobacco advertising around schools in Edinburgh, and we got academic publications out of that, and it cost hardly anything. So we built those links, and they were very generous in their time and their support, because I wanted the teaching, certainly at the master's level, to be both practice and policy focused, but also research based. And I was very keen that health promotion would have the same status as public health in terms of the skills and the capacities that people had. So we developed the masters, and several hundred people did it. It was really great in that I think we succeeded in, for example, the ESRC. We were one of only 2 masters in Britain that they funded for health promotion research training, as well as people going into lots of different fields. So on the undergraduate side, I was really keen for medical students to start to look critically at what their future role might be in health promotion, particularly around inequalities, and of course work with you and other colleagues in the wonderful, what's now Health and Society. But that was great. Edinburgh had this base of teaching behavioural sciences, which we could build on. And we did some really innovative work on that. In fact, the course was recognised by WHO Europe as one of the few examples of good practice in Europe, and I was involved in training for WHO Europe on other people developing courses. It was challenging. We did some really innovative stuff like using learning logs for students, which they found interesting or not so interesting. But again, it was about working, I think, in partnership and collaboration with people in the field in lots of different ways.
I think partnership working is probably a real hallmark of your approach to your career and how important that is, but really interesting to hear about that in an educational context, that actually through the postgraduate programs in particular, you were really keen that you could bridge the kind of research policy practice communities and embed research in those communities as well. So I think that's something that obviously continues to be very, very relevant in terms of how we develop postgraduate education in the Usher. And I can just see from the way you're smiling that aspects of the innovative process of thinking about curriculum development and how to use new ways to really promote engagement and active learning is something that obviously you really enjoyed doing. Yeah,
certainly did. And I think we were lucky in that we at different times had flexibility about being able to try out new approaches. We had a certain amount of freedom, which has maybe become a bit more constrained over the years. But on the other hand, a lot of these approaches to teaching are now much more recognised and their values recognised. So, you know, there's been gains on that side.
I want you to think back again to this kind of start of your career, because I think colleagues will be really interested in what one does in order to kind of shape a field and shape your own personal career. And I mean, clearly we're living in pretty tough times now, but it was tough times for social science and health promotion in the 1980s and 1980s too. So tell us a bit about how you managed to shape a career in those constrained circumstances. And perhaps any tips you'd give to colleagues today as we face different but nonetheless equally challenging times?
Yeah, it was, and you experienced that as well. There were cutbacks in grant funding. There were people lost their jobs at the Usher. You know, the staff reduced. I had my own experiences of that. So my first ever grant, I was so excited. It was from ESRC, which was pretty unusual in the 80s for someone in public health to get an ESRC grant. But they ran out of money, and anyone whose contract had not been literally signed off, they stopped. So I never got the funding. So that was a bit at the start of my career, a bit of a setback. But I think my approach very much for at least the first 15 odd years, when I don't think people realised tobacco was not an issue. It was the #1 preventable cause of death and still is in Britain, but it was not a funded issue. People were not interested in researching it. And so it was being flexible, being opportunistic, getting money where one could, focusing on research that had impact, which now, of course, is recognised. And I must go back to when I was in London, when I had a director of public health who was really radical and was basically saying, we use research to influence policy and practice, even little studies at that time. So it was very much looking at that. And also keeping grounded. So for me in health promotion, it was about working with people in the field. What were the issues? What were the challenges they were facing? And from that, you could often tap money that wasn't accessible through academic routes. So, for example, we did the first ever community-based interventions on women and low-income smoking in Europe. And that was with Usher Scotland, because we were able to access funding from the national agency to do that, which I wouldn't have got otherwise. So, but then things changed when the Labour government came in, because they produced the first ever strategy on tobacco, and suddenly it was an issue. So I think it was important that the partnerships, the relationships we'd built up in the years before that meant that when funding did become available, we were ready to go. And we'd been setting the agenda around inequalities and other issues. So I think we use, it's a bit of a cliche, but in health promotion about being nimble, and but yes, it's having an idea of clearly what the issues are and sticking with them, and sometimes having to be a bit flexible, but using opportunities when they arise, and always looking at the practice policy, but also getting publications out that are in good journals. Yeah.
So I think that really shows us that you can and have to kind of sustain commitment even in adverse circumstances, because then you're in a position to uptake new grant opportunities, other kinds of funding opportunities when things change. And I'm sure from the late 1990s onwards, we wouldn't have been able to proceed as quickly as we could in terms of research around health inequalities if there hadn't been you and many others who were constantly still trying to do that work despite the difficulties of getting funding. So I think tenacity is key in many ways, isn't it? But I guess also a kind of more local supportive environment, which I hope is what you experienced in your time at the Usher.
Definitely, I think that's been important, having that freedom to some extent of what you do and people having confidence in you. But also I was very lucky that my 5-year lectureship was then made permanent. So that gives you flexibility, and I really feel for people who are on more fixed term contracts and feel the time pressurizing them to produce or to achieve in certain ways. So I think that's a real issue today.
Yes, I think that's really insightful, because actually it's often a slow burn and small grants in some cases. Continuing to really develop teaching, all of those things together can help kind of shape careers and build capacity for the long term, which requires those kind of lectureship level commitments. What else would you say has been particularly important to you, or kind of a particular characteristic of your career?
I think having a passion about the issue, which started when I did my MSc, which was looking at the health coverage in the top women's magazines, which are now not important, but they were the internet of their day. It's where the majority of women got their health information from. And I was just shocked that all but one of the magazines took tobacco advertising, but had absolutely no coverage on smoking and women, which was the #1 killer of women. And that got me so angry, and I'm still angry, I suppose. So it's seeing the issue, but I've been able to come at it in different ways, and with support of people like you, like getting into qualitative research, which was quite a leap from genetics, but it's what's felt natural to me, that you wanted to hear about people's lived experiences. So to inform them what action we should be taking. So it was going with what you think is the most valuable in terms of increasing understanding and contributing to theory in some extent, but also in the way we can move forward in a field in different ways.
So I think that passion's important, because actually it makes your working life, well, one of commitment, but actually fun as well. So I do remember those piles of women's magazines in your office, and we used to tease you about them. So you know, because you also love them, as well as research them. So we trip over women's magazines, but as well as the BMJ and health promotion journals in Amanda's office. And you also work really closely with local communities, and I think that's also a really important part of the way in which you approach the issues that the important issues that you research. So just to finish up, we're obviously all really proud of your contribution, Amanda, and I'm delighted that we can celebrate it today, even if virtually. And we were delighted, of course, that you were recognised through your OBE last year, and I know that was something very special for you and your family. But what are you most proud of in terms of your achievements?
Well, I think I look at both sides in terms of the teaching and the research. I think the teaching is the legacy, that through the masters, people have gone on to a whole diversity of roles in health promotion, from national to local to some to international, and that carries on, and that's great. For the medical students, if I can share an anecdote, which I shared with you recently, I was in hospital and the junior anaesthetist, oh gosh, I can't hardly say it. I'm lying on the bed about to go in for an operation. He goes, "Oh gosh, your health promotion teaching and the intercalated year I did, it was transformational." And it's things like that about thinking that maybe some doctors have actually changed the way they think about health issues, particularly inequalities, and even as an anaesthetist, and think about, well, what might that mean? On the research side, obviously, it's the policy impact, and I was very lucky right at the start that our women's magazines research actually led to them tobacco ads being banned in women's magazines, and that was a fantastic start. And hoping that what I've done has contributed to the reduction, this massive reduction we've seen in smoking in Scotland and in Britain, and hopefully also in Europe, the work I've done there. So it's been an amazing time to see an issue that just wasn't that important, work really having been done on it, and hopefully I've contributed to that.
Oh, well, Amanda, you certainly have contributed to that, and it's a really nice story, and we perhaps don't celebrate those stories often enough, of the influence that's not captured in any kind of metric that we are required to produce, because actually education is transformative. Yeah. And it does make a difference to people's lives, and it's really nice when they tell us that too. So thank you. I think that's a very nice way to end the interview, and to encourage everyone to kind of keep at their passion and what draws them to work in the Usher, in whatever role they're in, because this is about health at the individual, population and planetary level, which we know remains a continued challenge, remains fragile, and health inequalities and the need for prevention is as strong as ever. So Amanda, thank you very much, and all the very best for your future retirement, but I know that we will stay in touch, and you'll stay in touch also with many, many colleagues who are here.
Yeah, I hope so, and thank you, and thank the Usher. It's been a fascinating 35 years. Thanks.